Hello and welcome to our COVID-19 special. I'm Monica Jones and I am a vegetarian. It's true. Been one for more than 30 years, even though my family then insisted that it's important to eat meat, a common notion in those days. So now there is a study that says vegetarians could be in better shape to deal with a COVID-19 infection. Let's find out why.
The idea that diet has a role in preventing disease has been around for decades, as has the dictum to eat a range of foods, including fruit and vegetables. Today, the outcome of a COVID-19 infection appears to be the latest in a string of ways in which vegetarians may fare better in terms of health. A recent US study published in one of the British medical journal's publications looked at how being predominantly vegetarian impacted the severity of a COVID infection. People who mostly followed a plant-based diet were found to be 73% less likely to develop a moderate to severe case of COVID if they did get infected. That's compared to those who ate a high-protein, low-carbohydrate diet.
It's sort of embedded in a huge discussion of how does diet help. The big problem here is how do we find this out? This is an interesting study because they use a population which is likely to be infected with COVID and likely to expose to COVID. So that is really interesting.
The participants in the study were frontline healthcare workers in France, Germany, Italy, Spain, the US and the UK. More than 2,000 doctors and nurses were asked to record what they ate, whether or not they got COVID, and if they did, how long and severe their illness was. Those who follow predominantly plant-based diets were much less likely to get seriously ill if they became infected, even when age and exercise habits were taken into account. But what we eat also reflects who we are more broadly. In Western countries, vegetarians are also more likely to be well-educated, health-conscious and female. These factors all have a bearing on the outcome of a COVID infection.
From my nutritional point of view, it's always, I think it's worrying about nutrition is generally not a good idea. It's in most cases, the diet is fine if you sort of get it somewhat balanced and don't go to one extreme or the other. I think the risk to push people into eating disorders is often worse than the benefit one could achieve.
For years, there's been a debate about the relationship between lifestyle choices and disease. COVID is just the latest reason to do so. And it shows that a healthier diet doesn't necessarily protect against disease, but it can support immunity.